All right. Happy Saturday, everyone. Hope everyone is having a good weekend so far. And thank you for joining me for this Overcoming Hyperthyroidism chat. All right. So it looks like I am live on YouTube as well. And all right. And hold on just a sec. Looks like audio is good. All right, so I'm here to make a couple of big announcements. I also had one of these calls on Thursday night my time, 8:30 my time. So some of you already might be familiar with the announcements or announcements, plural, two announcements. So anyway, I'll go ahead and jump into the announcements. And if there are any questions, I will be happy to answer your questions related to hyperthyroidism. So let's go ahead and all right. So the first big announcement is that I will be having another 5-day hyperthyroid challenge. So this one, the one in I had a 5-day challenge in February, and that was focusing on hyperthyroid. It was a 5-day hyperthyroid healing diet challenge. And so this time I'm having a 5-day hyperthyroid symptom relief challenge. And, my goal as a natural healthcare practitioner is to do more than manage the symptoms. But with hyperthyroidism, you want to be safe while trying to address the underlying cause. And I get a lot of questions about anti-thyroid medication and natural agents such as bugleweed and motherwort and L-carnitine. And anyway, so I figured it would be a good idea to put together this challenge, and we'll see. We'll see how it goes. We had a really good turnout for the hyperthyroid healing diet in February. And then in May, I had an accelerated thyroid healing challenge, and that went really well. And really, the only way to know for sure is to roll these things out and see how many people participate. So again, I will be having this starting Monday, August 16th, so a week from this Monday. And so the way it works, if you haven't attended one of my previous 5-day challenges, every day, starting again Monday, August 16th through that Friday, August 20th, you'll receive an email. So you will need to register if you're interested in signing up. But you'll get a daily 10 to 20-minute pre-recorded lesson as well as an assignment. You don't, of course, have to do the assignment, but yeah. Anyway, so if you just want to watch the video lesson, that's fine. So every day for 5 days, you'll get that lesson. Also, there'll be daily live calls on Zoom, just like we're doing right now. And yeah, it's not going to be live streamed to YouTube though. In the past, I would live stream it to the Facebook group, but I've had issues doing that. If I could figure out what's going on, because again, it's just they made some changes apparently to Zoom, and so I was doing that in the past, live stream from Zoom to the Facebook group. But as of now, it'll just be on Zoom, which is fine. And I will rotate the times in order to accommodate those in different time zones. So once you register, you'll get the schedule. But I believe Monday, August 16th, I think on that Monday, it'll be 8:30 p.m. Eastern time, Tuesday, 12:30 p.m. Eastern time, Wednesday, 8:30 p.m. Eastern time, and then Thursday, 12:30 p.m. Eastern time. And then on Friday, there'll be 2 Q&A calls, one again at 12:30 and another one at 8:30. And so in order to register, so the link is now live. It wasn't live the other night when I did this. So you could visit thyroidchallenge2021.com. And I think it's working okay. So the big email to everybody is going to be on Monday. So I apologize if there's any bugs. I don't think there will be. I've tested it out, but sometimes again, I might miss something until I send the email, and then others register, and things don't go smoothly. But again, I've done this a number of different times, so it's not like this is the first challenge I've done. But so anyway, so that's the website where you could register if you're interested. And again, you don't have to join the Facebook group if you're not on Facebook. No worries. But for all these challenges, I've had contests, and I mean, it's a place to connect with others, and then also just for fun, there's a contest. So it's difficult to do the contest like through Zoom, but and eventually maybe in the future there'll be another platform. I mean, I can't say I love Facebook, but just there's still a lot of people on Facebook, and I've actually tried another platform. I use a platform Kajabi, which is where I host some things like videos and things. But anyway, it just there wasn't nearly as much as engagements in the Kajabi group as the Facebook group, but it's not as nice of a group as Facebook, but there's others that I might test out in the future. So that's first announcement. So again, free 5-day hyperthyroid symptom relief challenge that starts on Monday, August 16th. And so definitely consider taking advantage of it. And again, feel free to register, thyroidchallenge2021.com. Once you register, you should receive a welcome email. Well, first you'll get a page, and then if you want to join the Facebook, on the confirmation page, there'll be a link to the Facebook group if you're not already part of that. And then you'll get an welcome email, and that welcome email will have the link to the Zoom calls. There's going to be just a single link to all the Zoom calls, and I'll have the schedule and all that. And then you'll be on the email list. So starting Monday, August 16th, it's probably like 6 in the morning is what I've done in the past. Again, it's pre-recorded, so it's not like you have to be available at that time, but you'll get an email with the pre-recorded lesson. And they'll be available for about a week. The goal is to like the 30th, I'm sorry, the 23rd. So that's Sunday. So the goal with the challenge is to have you take action, not to, because again, if there's unlimited access, and people, what they do is they just don't take action. And so that's the purpose of the challenge. And then the second big announcement is I will be finally launching my new podcast, and it should be coming in late August. The only way it won't come in late August is if there's any problems with technology, which, if there's any delays, it shouldn't be like a huge delay. But the goal, I have episodes available. So it's, as far as recording episodes, I do have some editing to do, but that doesn't take too long. So anyway, I am aiming for that final week of August, which overlaps with September. So late August, early September, new podcast. It'll be called the Save My Thyroid podcast. And again, more details to come soon. So that is it. And okay, we got John from New Jersey. Nobody here ever says that. Well, welcome, John. Yeah, if anybody else wants to let me know where you're zooming from or where you're tuning in on Facebook, definitely let me know. But those are announcements. So if you have questions, definitely let me know. I'm going to scroll back to the page on the challenge, the slides that talk about the challenge for anyone who trickles in late. So you could see, at least they could see the first announcement. But okay, and Aylin, I'm hoping I'm pronouncing your name right. Aylin, hello from Israel. Well, thank you so much for joining us from Israel. And let me see on YouTube. Let's see. Chinaza says hello, doctor, and hello. And let's see, Azadar, as a question. So we'll get questions in a minute. Atlanta Angel, hello. And then somebody here from Arizona. All right, so again, if you have questions, let me know. We have a question here on YouTube about Graves' eyes. So someone is Azadar is experiencing Graves' eye disease. How can I heal it, please? So Graves' thyroid eye disease. It's so Graves' disease is more of an immune system condition, not really a thyroid condition, but an autoimmune condition that affects the thyroid. And thyroid eye disease is also, hold on just a sec here. Let me just hold on, just I apologize. Disease is more of an immune system condition. I forgot to mute the YouTube. All right, let me go back. All right, I'm sorry about that. So, all right, so let's see. So thyroid eye disease, again, that's also immune as well. So there's a lot of overlap when it comes to treating thyroid eye disease and Graves' disease. You need to find and remove the triggers. And there's, I talked in the past, sorry, I'm getting an antiviral message on my, so in the past, I've spoken about the 4 categories of triggers. So one would be food. So certain foods can be a potential trigger. Number 2 would be stress. Number 3, chemicals. Number 4, infections. So food, you want to eat a clean diet and anti-inflammatory diet. Try to avoid common allergens such as gluten, dairy, corn, and a lot of patients I recommend autoimmune paleo. There's no perfect diet for everyone. So again, it doesn't mean everybody absolutely has to follow that type of diet. But the thing about autoimmune paleo, you're avoiding those common allergens. You're avoiding some foods that are harsh on the gut, and most of the immune cells are in the gut. So you're avoiding things like food like grains. You definitely want to try to avoid refined foods and sugars and unhealthy oils. And so diet wise, a lot of people who have been following me for a while, they've already done things for the diet. And if things aren't, so it's a great starting point, but many people need to do more than diet, as well as stress management. Sometimes infections could be a factor. And again, chemicals like mercury, glyphosate. Yesterday, I had a call. I interviewed Sarah Philippi on breast implant illness. And while most patients I work with don't have breast implants, really, even if you don't have breast implants, one of the big takeaways from the call is that the impact of toxins, in this case, we were talking about breast implants, but we also mentioned other toxins. She mentioned mercury amalgams, for example. And again, I just mentioned glyphosate. We live in a toxic world. And so trying to do things to reduce your toxic load. There are some things you could try, and you could also find some information on my website, naturalendocrinesolutions.com. So selenium, for example, could be something that helps some people with thyroid eye disease. And just selenium is a cofactor for glutathione. So also just doing things to increase glutathione, having healthy vitamin D levels, D as in David, vitamin D. When people think about vitamin D, they think about bone health, or some people think about bone health, but it's also important for reducing inflammation. Having healthy omega-3s are also important. So sometimes I'll have people take a higher dose fish oil. And so, but definitely check out my website. I not only have written some articles, but a few months ago, I interviewed an ophthalmologist who takes an integrative approach to thyroid eye disease. Her name is Dr. Ronnie Bannock. So, check out, that's actually on my YouTube channel. So you're on, the person who asked this is on YouTube. So my Natural Thyroid Doctor YouTube channel, that interview is there, but it's also on my website. I transcribed it. So, and I will say sometimes in severe case of thyroid eye disease, it can be tough to reverse it. There is a newer treatment method called Tepezza, which Dr. Rani spoke about, and I have a blog post on my website on that too. It is expensive and not available everywhere. So like it's in the United States, but not necessarily in other countries. So, so yeah, hopefully that helps. And let's see, Ganezas, good afternoon from Florida. All right, well, thanks for joining us from Florida. And again, if there's any questions on Zoom, let me know. But right now, I'll answer another question from YouTube, which is from Atlanta Angel, and I assume you're in Atlanta. So I have Graves' disease, but it's in remission. I'm always cold all the time. Could that be related to thyroid? I mean, it could be, you said you're in remission, but low thyroid can be a factor when it comes to coldness. So you might want to do a thyroid panel. And if the TSH, so an optimal range for TSH is between 1 and 2. If that TSH starts getting above 2, many endocrinologists, many medical doctors in general would not label someone as being hypothyroid until that TSH is outside of the reference range, and that depends on the lab. But if it's a TSH is a 2 or 3, that is, outside of the optimal range, and that could be a factor. Circulation, problems with circulation, could lead to coldness as well. So, but yes, it is a possibility that could be related to thyroid. All right, and again, if anybody trickled in late, just there were 2 announcements I made. So this is one, you're looking on the slide. I just left the slide up for anybody who trickles in late. The first announcement was the free 5-day hyperthyroid symptom relief challenge that's starting Monday, August 16th. And you could register by visiting thyroidchallenge2021.com. And then later this month, late August, early September, I'll be launching my Save My Thyroid podcast. So be on the lookout for that. So those were the 2 big announcements. And all right, and we have Linda from sunny Florida. So a few people from Florida attending. All right, and again, thanks for taking time on the Saturday afternoon to join me. And again, if there's any questions, let me know. The other night when I did this again Thursday evening, and there were a good amount of questions. We went a little over an hour. So again, if there's not a lot of questions, I definitely have no problems calling it a day. But just doing this, and I, to be fair, I do a lot of Facebook Lives. Again, I did one yesterday that was during the day. So I think also with the evening call, I don't do a lot of evening calls like I did. So I've been doing most of the, the Facebook Lives I do are during the day. So I know some people get their questions answered during the Facebook Lives. And again, the upcoming challenge is a great opportunity to get questions answered as well. So even though we'll be focusing on hyperthyroid symptom relief, and I'll be talking also on day number 5, I'll be talking about beyond symptom relief. And okay, let's see. So Leora, I had successfully medicated Graves' disease for many years. I still have major blood sugar level issues, even though I do most of what is recommended. Any thoughts? So blood sugar, I mean, of course, diet is important, but it's not everything when it comes to blood sugar as well. So insulin resistance, for example, or, there's insulin resistance, hypoglycemia. So insulin resistance is when insulin can't get into the cell, and so hyperglycemia is higher blood sugar, hypoglycemia, low blood sugar. And diet could play a big role, but it could be more challenging. I do have articles on both of these as well. So insulin resistance, inflammation is usually a big factor, and sometimes it can be challenging to find out what's causing the inflammation. Hypoglycemia also could be challenging, and like food sensitivity, food allergies, food sensitivities could be a factor with that. So I would definitely start with diet and lifestyle, but doing things to reduce inflammation. Sometimes you have to correct certain deficiencies like chromium, magnesium are minerals that are important for insulin sensitivity as well. And eating well is important, but supplementation sometimes is important. Sometimes healing the gut, because again, if someone has, let's say low stomach acid, they might be eating really well, but maybe not breaking down the minerals that are important. So again, there's a number of different factors to consider. Let's see. So Linda, do you have any experience with Kachnar or Google to shrink or eliminate thyroid nodules? It was recommended by a practitioner, so Ayurvedic practitioner. So no, not specifically. So with nodules, you need to remember you want to address the cause of the problem. So I haven't found like a single herb or supplement that shrinks thyroid nodules. And you want to, what's the cause of the thyroid nodule? So one potential cause is problems with estrogen metabolism, and then insulin resistance. I wrote some articles on thyroid nodules that you could find on my website. And again, estrogen metabolism issues and insulin resistance are two big factors. So I spoke with a patient on Thursday who was getting actually received radio frequency ablation for thyroid nodules. So that and that could be very effective too. And I know you're not bringing this up, but same thing with her. I told her, well, it could get rid of the nodules, but it's not going to get rid of the cause of the problem. So it is possible for them to grow back. So again, I wouldn't rely on like a single herb or supplement when it comes to, not to say you can't try taking that. That's up to you, but my goal is to try to address the cause of the problem. And sometimes we do recommend supplements to help support and to give to address the cause of the problem. But yes, that's and actually John's question kind of relates to what I just said. So I didn't see this until I just answered this. So John asked, do you know what causes thyroid nodules? I always thought they exist only people with hypothyroidism due to lack of iodine, but hypothyroidism. So yeah, both hypo or hyperthyroidism. Iodine deficiency can be a reason for it too, the thyroid nodules, but sometimes iodine can cause an increase in thyroid nodules. So that's something to keep in mind. And you want to be cautious with iodine if someone is supplemented with iodine. But yeah, so that could be a factor. Again, the estrogen metabolism, I mentioned is common. And then problems with insulin resistance, blood sugar imbalances. Okay, and you are welcome, Leora. All right, so we have some questions in YouTube. So if there's any other Zoom questions, let me know, but I'll move on to YouTube here. So Christina asks, how do I get my T3 and TSH levels normal and help diminish heart palpitations naturally? So when I dealt with Graves' disease, I was diagnosed with Graves back in 2008. And so I had the depressed TSH and elevated T3, T4. And so I took bugleweed and again, I'm going to talk more about this during the Hyperthyroid Symptom Relief Challenge, but I took bugleweed to help with the symptoms. I personally did not take antithyroid medication. A lot of my patients do, so I'm not opposed to it, but I took the herbal approach. And so that did help, but at the same time, I knew that wasn't addressing the cause of the problem. So I did adrenal testing and mineral testing and blood testing and again, so I did things to try to find triggers and underlying imbalances. Some people need a comprehensive stool panel. There's organic acids testing. Again, I tend to be more conservative with the testing, although ultimately it's up to the person I'm working with. And I realize, Ganesh, I just skipped over your question, so I'll get to your question after Christina's. I apologize for that. So yeah, so from a symptom management relief, like for a, an herbal approach, you could take, consider taking bugleweed, and I'll be talking about other things like L-carnitine, but you want to address the underlying cause of the problem. And I'm going to talk about that too during the challenge. It's not going to be, the focus will be on symptom relief, but I'll be talking about, going beyond symptom relief as well. So definitely consider registering. Again, that link, thyroidchallenge2021.com. And Ganessa asks, can magnesium help sleep while magnesium level is normal? Sometimes. I mean, magnesium, first of all, serum magnesium isn't really reliable. There's RBC magnesium if you're doing a blood test, which is better, but there's also, again, there's normal and there's optimal. So like RBC magnesium, some sources like to see it 5.5 or greater. And so if you're, let's say, at like, 4.9, or 5, even 5.1, 5.2, then, then yeah, it is possible that addressing that by taking some magnesium can help. But there are a lot of issues that can interfere with sleep. High cortisol can cause problems with sleep. But magnesium is, for most people, just about everybody. I hate saying it's safe, any single thing is safe for everybody, but again, it's low risk for the most part, taking magnesium, and sometimes it can do wonders. But again, there could be other factors causing sleep issues. All right, so yeah, that's the one thing. One thing that's that I like about YouTube is some interesting names. So, where it's like Zoom, people just enter a name, but then on YouTube, people just have their, if they're already a member of YouTube, they sometimes have unique names. So here we have Coco the monkey, who's from Boston. So thanks for joining us from Boston. What can I do to help lower my TRB, which is a TSH receptor antibodies? So gluten-free, and I'm working with a functional medicine practitioner to heal leaky gut, which is great. That's awesome that you work with a functional medicine practitioner and that you're gluten-free. And so what lowering, and I kind of mentioned earlier when someone asked about Graves' disease, and I spoke about the different triggers, so according to the triad of autoimmunity, there's 3 components. There's genetic predisposition, exposure to one or more environmental triggers, and a leaky gut. So you're working with the functional medicine practitioner to heal the leaky gut. And, gluten could be a factor with the leaky gut, which you've eliminated, but there could be other factors as well. So again, I assume your functional medicine practitioner is helping you with that. But then there could be other triggers. It could be, food could be a trigger. It's not just gluten. There, sometimes dairy or corn could be a factor. And sometimes it could be infections. There could be, again, certain chemicals that could cause a factor. Yesterday, again, we spoke about breast implant illness, which, so we spoke about silicone, certain toxins associated with breast implant illness. And we spoke a little bit about infection. So I wish I could say this is, these are the 2 or 3 steps or the 5 steps you need to take, but you need to find and remove. The first step is try to find and remove those factors that's causing the elevated antibodies, those triggers. And I have some information again on my website, like there's an article, if you do a search, how to lower thyroid antibodies, but I'll be also talking in that article and that blog post, I talk a lot about what I just mentioned here. But again, something is triggering that autoimmune response, and having a healthy gut's important too. So I'm glad you're, again, working with that functional medicine practitioner. Okay, and Thado says, hi, everyone, all the way from South Africa. Thank you for joining us, Thado. And Christina, you're very welcome. And so Ganessa asked, is it true that the higher the TSI level at the diagnosis, the harder to get into remission? Not necessarily. I mean, I will say that the higher the TSI level, the more vigorous the autoimmune response. But it's not necessarily the hardest to get into remission, because a lot of it is about finding, removing triggers and about healing the gut. So if your triggers are found quickly, then it's possible to get into remission quicker than someone who has lower TSI levels, but they might have some triggers that are more difficult to find. Like, for example, like I said, diet, I think it's not the only answer in most cases, but it's a good place to start. And there are some people that's all they'll do is eliminate gluten, clean up their diet, and that might be enough to normalize TSI. But most people need to dig deeper. And again, so I definitely wouldn't get discouraged just because you have high TSI levels. Either way, it takes time. Even if someone has lower TSI levels, it's not like it's a 3-month process to get into remission. It's like I was taking bugleweed and motherwort for about 9 months until everything normalized, and then even after that, I would say you want to do a few follow-up tests, make sure everything is staying normal. So definitely it's takes a while. And for me, I would say, like, I wouldn't say mine was a mild case of Graves, but it was kind of in the middle. So but again, some people it does take a longer process even. So all right, so Vaughn, I'll get to your question, then I think we might have some in Zoom again. Oh, actually, so Atlanta Angel. So let me get to Vaughn, because I didn't get to a question for her, and then I'll answer your question, Atlanta Angel, and then I'll go to Zoom. So Vaughn, I started with hyperthyroidism, Graves' disease, and now you're hypothyroid. I've been taking thyroid meds for about 20 years now. I stopped for about 2 years. My level up to 60.44, which I'm assuming you mean your TSH, or thyroid stimulating hormone. Now I'm back on meds. So how do I get off, or can I now? My liver and kidneys are dependent on the meds after 20 years. No, if you talk about thyroid hormone replacement, it's not that your liver and kidneys are dependent, but it really depends on how much damage is done to the thyroid gland. Some people are able to get off thyroid hormone replacement, but some people do need to be on it on a long-term basis. So it really does depend on the person. So, as I said, just with some of the others, I would still try to find out, some of the triggers, underlying imbalances. Do you have the antibodies for Hashimoto's, elevated thyroid globulin antibodies? And a lot of people with Graves have elevated thyroid peroxidase, or TPO antibodies. But again, those could mean that there's damage to the thyroid gland taking place. But so 20 years. Obviously TSH of 60.44 is pretty high, but the question is how much medications you need, how much thyroid hormone replacements you need to get that level between 1 and 2, which is optimal. If someone needs, just giving a simple example, not that I recommend everybody to take levothyroxine, there's also desiccated thyroid, but if someone's taking, let's say, 50 micrograms of levothyroxine, and that's getting their TSH between 1 and 2. Well, 50 micrograms of levothyroxine isn't too high of a dose, so that's indicating maybe there's not a lot of damage to the thyroid gland. Again, that doesn't mean that the person could absolutely get off thyroid hormone replacement, but if someone's on 125 micrograms, it probably would be more challenging. So again, it's the duration. It's not just the duration, but really how much damage has taken place to the thyroid gland. All right, so Atlanta. Oh, and Vaughn said, my liver and kidney enzymes went up when I got off. Yeah, well, it's not that the liver and kidney got dependent, but thyroid hormone is very important for every cell and tissue in the body. So it's not that you can't get off because your liver and kidney are dependent. The reason you couldn't get off is because you needed a thyroid hormone, and there's no natural, like there's no herbal replacement for thyroid hormone. Now there's glandulars like Thyrogold, for example, is one that's been out of stock for a while, or there's, again, desiccated thyroid. It's still thyroid hormone replacements, but it's not that they're dependent. if the enzymes went up, the liver enzymes and kidney markers went up, when getting off of the thyroid hormone replacements, again, if you, yeah, it sounds like you just had a lot of stress in your body. And again, some people do need to take thyroid hormone replacements. And those who are able to get off, it's usually because we're correcting other imbalances. If someone just stops taking it just because they don't want to take it, and maybe they clean up their diet, so they think, okay, I've done followed a strict diet, and so now I could try getting off the meds. But again, a lot of times people have to dig deeper. All right, so Atlanta Angels, thank you for answering my previous question. Is there a correlation between Graves' disease and issues with ovarian failure or other reproductive issues? I'm not sure about ovarian failure. I would say that's more extreme. Not to say there can't be a relationship, but it's not something I've really seen. But yeah, it could cause problems with reproduction, with fertility, with Graves. Yeah, so definitely something, if someone is trying to conceive, it probably is a good idea to get the Graves' disease under control. And again, not just the thyroid. I mean, some people will take the medication and could have a healthy pregnancy, but again, remember, it's more of an immune condition. So I would say, yeah, you want to address, if you have elevated thyroid hormone levels, you want to address this, but you also want to address the autoimmune response. All right, so I'm going to get to some Zoom calls, and then I'll go back to YouTube, and I'll go until 4 o'clock my time. So another 23 minutes. I have 3:37 my time. And again, just the announcements for those who trickled in late. Again, if you attended on Thursday night, you already know the announcements. So this is one, the challenge, 5-day challenge that's coming up, but also second announcement is the release of my podcast that's coming out late August, early September. All right, so Elizabeth, how are you doing? And thank you for joining us. So what are nodules? How can someone know if they have nodules? Are there symptoms that people experience? Yeah, so again, I would definitely check out my website. Nodules are pretty common. They're just on the thyroid gland, and think of it as like little growths or little bumps. And they could be malignant, but most of them are benign. And really, most of the time, people will know only if a thyroid ultrasound is done. Sometimes endocrinologists could tell by feeling, by palpating the thyroid gland, especially if they're larger. But most people, they're not going to be visible. There are exceptions, but a thyroid ultrasound is something to consider. And again, most of the time, they don't necessarily cause symptoms, I would say, most of the times. And yeah, but they are common. And Linda, why would I have thyroid nodules when all my thyroid markers have been normal, optimal in your ranges since going gluten-free and clean plant-based diet? I'm not insulin resistant. I'm postmenopausal and need a lot of cruciferous vegetables. So question if I have estrogen metabolism problem. Yeah, I'm not sure. I wish I had all the answers, Linda. I will say we live in a toxic world. And when it comes to estrogen metabolism is complex. It's not, I mean, it's great that you're eating a lot of cruciferous veggies. And again, I'm not saying you have estrogen metabolism problem, but there's a enzyme in the gut called beta glucuronidase. If someone has a comprehensive stool panel, that like GI map and GI effects by Genova, they look at beta glucuronidase. And so if that's elevated, that also could be a sign that there's problems with estrogen metabolism. And that's related to dysbiosis. Like the gut could also play a role in what problems with the clearance of estrogens. And some people will say, oh, I have no gut issues, regular bowel movements, no symptoms, no digestive issues, but you can't always go by symptoms. And I'm not saying it's an estrogen metabolism problem. Again, sometimes we don't know. I can't say 100% of thyroid nodules are caused by problems with estrogen metabolism and insulin resistance. arguably other toxins, not just clearing estrogen, because I think of estrogen as a toxin when we can't clear it, but potentially other toxins, and we all have toxins. Even if, myself, I'm more aggressive than probably the average person when it comes to reducing my toxic load, doing things like sauna, also eating plenty of cruciferous vegetables. But again, it's, everybody's also genetically different when it comes to excreting toxins. Like same thing with estrogen metabolism. There's some genetics where some people are more susceptible to problems with estrogen metabolism, and cruciferous vegetables might not be enough. They might need to take, diindolylmethane or DIM, for example. But like I said, I'm not exactly sure. It sounds like you're doing a lot of good things, which is great, which I know makes it more frustrating if you have thyroid nodules. But if it's not due to the insulin resistance, not due to the estrogen metabolism, then obviously it's due to something else. What is it due? Is it due to other toxins? Or again, is it due to estrogen metabolism? Even though you're eating cruciferous vegetables, it is possible. All right, so Sarah just got diagnosed. It's funny how like all these this happens a lot where, whether I do Facebook Lives or Zoom calls where, the first, 10, 15 minutes, I'm wondering if there'll be enough questions where I'll be ending it after like 20 minutes to call. And then the questions, as soon as like a few questions come in, it's like a chain reaction. Like, see, like, it's like people are just waiting for someone to ask the first question or two. And now, if I had to guess, we might not get to all questions. So I'll try my best, but if not, just, again, for those with hyperthyroidism, I'm doing the free challenge. And then again, I do Facebook Lives. I'll be doing a Facebook Live next week. It'll probably be hyperthyroid focused just because of the challenge. But if you have hypothyroidism, Hashimoto's, you could still pop in and ask questions. So Sarah just got diagnosed a month ago, started methimazole, 10 milligrams for a month, but focused most on fixing leaky gut, bone broth, cut out gluten. Main doctor said I improved a lot, wanted to up my dose to 15 milligrams. I declined, and I'm thinking of adding LDN, which is low dose naltrexone. Any thoughts? Well, I mean, it sounds like you're doing a great job on trying to, drinking bone broth for the gut and cutting out gluten. And, yeah, so I don't know if I'm guessing your numbers maybe went up a little. And so, so 10 milligrams, it's a lower dose. 15 milligrams, an extra 5 milligrams isn't a huge dose, but I understand. Again, a lot of my patients take antithyroid medication such as methimazole, but I personally did not. So I'd be a hypocrite if I told you, to consider increase. I mean, ultimately it's your decision, but low dose naltrexone, again, I've written some articles on this, and it's something to consider, that it modulates the immune system, and of course Graves is autoimmune, and it could benefit other autoimmune conditions too. The problem with LDN, it is hit or miss. So it doesn't work on everybody. But it is something to consider. Some people also, they'll take the methimazole and they might add some bugleweed. So they're taking two things with antithyroid properties. If they're doing that, I usually recommend not taking it, right together, maybe like waiting 45 minutes or an hour. But that also is something that, again, I can't tell you to do that, but something to consider. So yeah, I would say those are two options. If you don't want to increase the dose from 10 to 15 milligrams, LDN is something to consider. And again, it might work well. LDN, sometimes, like I said, it's hit or miss, but when it works, it could work really well. So yeah, and just getting a prescription, not as difficult as it used to be, especially in the United States. There's places where you could do like remote consultations if you can't find a local doctor. All right, so Natasha has Graves. What would be considered mild or severe case? My T4 is 2.01, TSH 0.005. So TSH in just about every case of Graves, like 90 to 95% of Graves disease, it's less, like it's extremely depressed. So you can't go by TSH. So 2.01 actually is not too bad for T4. I hate saying it's mild. I mean, but the T4 at least is on the mild side, and then the TSI. Now there's different labs have different units for TSI. So if TSI is really high, let's say some use a percentage, like where less than 120 is considered normal. So to me, like around like 200 or less would be like mild, between 200 and 300 would be moderate, and over 300 more severe. And then T4, some labs won't go higher than like 7 or 8 for the T4. So if it's like that high, then it would be more severe. If it's like a 3, so I would say 2.01 on the more mild side. And you're not taking any medication, you mentioned, but yeah. So again, to me, it's more mild. So not taking meds at the moment, but I've been advised to remove the thyroid via surgery, since the radiation treatment may have some side effects in the future. Yeah, I mean, it's up to you. I mean, my goal, that's the goal of my future podcast. It's called Save My Thyroid, because that's been my goal. That's been my mission, since working with people over, since 2009, since I've been in remission with Graves. So again, it's up to you. There's never a guarantee of getting to remission, even with mild cases. But and someone asked earlier, is it more difficult to get into remission with severe? And that's what I was kind of saying. There are some people with severe cases of Graves or Hashimoto's that get into remission, and some cases that seem more mild, and it's a struggle finding the trigger. It's not, even though it's mild, sometimes it could be challenging. Okay, why can't we find out what's triggering it? So, okay, Linda says, hi, could be toxins. We've had bad red tides down here in Southwest Florida. Yeah, again, and that's the nodules again. So, yeah, again, like I said, the body is complex. Sometimes we just don't know, but that's one thing that's obviously over the last few decades just getting worse and worse, just the exposure to environmental toxins. All right, so I'm going to answer this, and then I'll get to some YouTube questions. I'm going to go until 4, so like another 12 minutes. Sandra says that my mother has been suffering from the problem, and the doctor prescribed a medication. It starts to cause clotting and some bump on her leg and her groin. Yeah, so I'm not sure what problem and what medication, if it was the methimazole, which typically doesn't cause clotting. So I'm not sure. So, but yeah, thyroid hormone replacement, for Hashimoto's, and then methimazole antithyroid medication, I can't say commonly causes. It commonly causes side effects. Clotting isn't one of the more common ones. So I'm not exactly sure what's what's going on. But all right, so let's look at some more. So let's see. I'll try to get, again, I'm going to try to get to all of them, at least that are posted now. To have another like 11 minutes. So any new questions, I'm not sure. But Hassan, I haven't answered a question from Hassan. So Hassan takes levothyroxine, 50 micrograms. Iron is normal, but I feel sluggish. TSH is normal. T4 is normal. Thyroglobulin is elevated. Well, it would be nice to see T3, because T4 converts to T3. And, I do see sometimes when, T4 is looking good and TSH is, at least within the lab range, sometimes not optimal. And a lot of things can cause someone to feel fatigued, sluggish, but definitely would want to see T3 to make sure T4 is converting into T3. You said iron is normal. Again, just be careful about the use normal versus optimal. Like, for example, someone I got an email from a patient where, their labs, their iron saturation was 21, which is normal according to the labs, but optimal would be between 30 and 40. some will say even like 35 and 45. But either way, 21 is still less than optimal. So same thing with other labs as well. So thyroglobulin, is thyroglobulin elevated or thyroglobulin antibodies elevated? Because there are differences between the two. So thyroglobulin antibodies, that means it's autoimmune, and the antibodies for Hashimoto's. Thyroglobulin being elevated, could actually be an iodine deficiency, rare cases thyroid cancer. But if it's the antibodies, then you want to address immune system, of course, but just might need to, this is where functional medicine practitioner comes handy, because they'll look at your labs and they'll tell you, well, maybe this is not optimal, or maybe it is optimal and you need to do further testing. So, all right, let me. Oh, T3. Okay, you said T3 is normal again. Yeah, and maybe it is. Maybe it's normal. Maybe it's optimal. So that would be, and if it is, if TSH, T4, T3 are all not only normal but optimal, then I'd be looking elsewhere, like adrenals, for example, or maybe other nutrient deficiencies. All right, so Coco the Monkey, thank you for answering my question. As a follow-up, what do you think about cordyceps as a supplement to help regulate immune response? I mean, cordyceps, I do like that. I can't say I use it a lot. It's also an adaptogenic herb. So yeah, yeah. So again, I'm my goal in the future is to write more articles like on mushrooms, and cordyceps would be like one of them also that I talk more about. But it's or maybe just an article on cordyceps, I don't know. But like I said, there's a lot of different herbs and supplements, and just keep in mind, nobody has a cordyceps deficiency, so it might be able to help to modulate the immune response and to support the HPA axis, the hypothalamic pituitary adrenal axis. So additional support maybe, but yeah, I can't say by itself. It probably won't regulate the immune response just alone. Okay, and Vaughn says, thank you. I now understand, but being off, I felt 100% better, and my body responded the opposite way it should have. When your TSH levels are low, I didn't gain weight or feel sluggish. I lost weight and had more energy. Yeah, interesting. It is interesting. What I would suggest is, schedule an appointment with, again, when I say schedule an appointment, it doesn't need to be with me. We're actually kind of backed up, as far as our appointments recently, so it could be with anybody who has good experience with thyroid. And because I would say you want to not look at TSH. If TSH is like, I think yours was like 60, 64, it was over 60. And so I'd want to still, I would say you want to still have someone look at the numbers and see, when you're off of it, how does T3 and T4 look? I mean, I've seen unique situations where someone is off the thyroid hormone and they feel better even though they're overtly hypothyroid, or maybe they're not overtly hypothyroid but more subclinical, where T3, T4 are on the lower ends. So and if not, maybe it's something else. Maybe it's adrenals. If someone has a problem with adrenals, that can affect conversion of T4 to T3. That's another issue too, and that could affect TSH. Could be a pituitary problem as well. So again, it's just, yeah, it sounds like you might need more detective work. And I agree. A lot of people, when they take, especially if they take synthetic thyroid hormone, like Synthroid, and Synthroid also has other things like other, fillers and other ingredients. And some people just don't feel well. They might feel better on desiccated. But again, it might not be a thyroid hormone replacement problem, might be more pituitary or more of a conversion problem. So that's where, maybe digging deeper into the labs. And again, maybe you might need additional lab testing like adrenals. All right, so Christina, how bad are my T3 levels if they're 6 and my TSH is 0.005 and T4 is in the normal range? Yeah, 6 isn't too bad. I've seen, of course, ranges are different from different labs. So like if it's the units that I'm used to seeing, then like a normal range between, it depends on the lab, but, would be between like 2 and 4, or some labs will use between 2.3 and 4.3. So I've seen, with that reference range, I've seen levels over 20. Usually the labs, like, it won't go over 20. A lot of labs will be like greater than 20. So 6 is, so I'd say mild to moderate, just definitely, definitely not severe, more on the mild side, maybe a little bit and I would say, I don't even know if I'd consider it moderate, but okay. And Hassan said autoimmune. So yeah, like I said, if you might need to, just what a few people here, sometimes you need to dig deeper. It's not always a clear, when looking at the numbers too. So it's and yeah, Vaughn, speaking of which, Vaughn follow up saying, my doctor said I'm a rare case, quite mysterious. Yeah, so again, just and so I would go beyond your medical doctor if that's who you relied on, and medical doctor, endocrinologist. I've seen, again, I would look more into a natural healthcare practitioner, functional medicine practitioner. And Hassan, I'm taking over 200 micrograms selenium, other nutrients, so I don't think any deficiency, also genetic condition. Yeah, the argument I'll say, if you're taking selenium and other minerals, but if your gut's less than optimal, and like I said, you can't always go by symptoms. With I've had people where where everything seems fine, there are no symptoms, regular bowel movements, no digestive symptoms, regular bowel movements, and they test positive for a parasite, or that that you might have low stomach acid, which is not easy to test for that, but yeah, so that's yeah, like I said, you don't want to fall into the trap of making assumptions. And again, I'm not saying that is the case with you, like the low stomach acid or a parasite, but we can't rule these things out. Sometimes we need to dig deeper. And that's why it's, even with the functional medicine practitioner like myself, sometimes, I get stumped and puzzled. So it's not like I have all of the answers, even not, here, obviously I don't have all the answers, because again, I'm just going by questions and don't have labs. But even when I do testing, a lot of times I do have the answers, but there are some times when I'm just not sure, when things aren't making a lot of sense. And that's the challenge. Like, you bring your car into the mechanic, let's say, we have a, we're a Toyota family. So, we have a Toyota Camry, Toyota Highlander. So, we bring in our Toyotas to the mechanic, and most of the time, especially these days, everything computerized, you usually can figure out what's going on because everything's the same. And every, I mean, maybe little variations, different years of our modules, but the human body is so complex and there's so many different factors that sometimes even practitioners will get stumped. Okay, and Hassan says, yeah, I think a leaky gut. And Vaughn, thanks so much. You are welcome. Christina says, thank you. You are very welcome. All right, so I think I pretty much am caught up with YouTube. So I'm going to move on to Zoom just for a couple more questions. And then again, I'm going to call it a day. So Natasha, can removing the thyroid gland prevent Graves' eye disease? And how do you know if you're in remission? So removing the thyroid, it's not foolproof when it comes to removing thyroid eye disease, or preventing Graves' eye disease, thyroid eye disease. And just remember, thyroid eye disease is more immune condition. So even if you were to get rid of the thyroid, like if someone has Graves' disease, a thyroid eye disease, and you get radioactive iodine or thyroid surgery, you still want to do things to address the cause of the problem. You don't want to just rely on, the surgery or radioactive iodine. And, as far as how do you know if you're in remission? So, how I knew is I wasn't taking anything that was influencing the thyroids. I was off the bugleweed, and I wasn't taking anything else like anti-thyroid medication. And not only was my TSH, free T3, free T4, within optimal levels, but my antibodies. In my case, I just had TSI antibodies. Some people do have TPO and or anti-thyroid globulin antibodies, even with Graves. But in my case, my TSI was well within the range. I don't look for zero antibodies Some labs, what they do, they don't even go down to zero. It'll be like less than such and such. But and then, over the years, I've been just keeping track of my thyroid and antibodies. In 2018, I was diagnosed with chronic Lyme, and I was nervous about relapsing. But I retested all not just TSI, but I tested thyroglobulin and TPO antibodies, and fortunately, everything has remained stable. But all right, so this is going to be the last question. I will refer quickly to YouTube. Just Hassan says, I take probiotic, lactospore complex, and Solgar digestive enzymes, which is great. And Ganessa, thank you, and have a great weekend. And you too, Ganessa, thanks for tuning in. But Tanya, so again, last question, and then I'll say my goodbyes to everyone. And Tanya, diagnosed in 2019, I was on the verge of thyroid storm. Since then, I've been on a seesaw between hypo and subclinical hyper. I've been on 5 milligrams of methimazole, now reduced to 2.5 milligrams. I've gone off meds for 2 to 3 weeks at a time and begin to go hyper, again, subclinical, not sure what my new ideal normal is. Now, once we are hyper, do our normal range values change? I tend to feel tired when my TSH is around 2 and T3 is 123. I've just never felt the same. I'm on a keto diet that has helped me some. My TSI and TPO antibodies last tested in 2020 were on the high 300s. So, I mean, TSH, once it gets, for some people, everybody's different, but I like to see it less than 2, and really between 1 and 1.5 is where some people feel their best. So you're feeling tired when a TSH is around 2, and then total T3 is 123. So, and I've had some patients also struggle too, where, as far as they're on a low dose of methimazole, like 2.5 milligrams, which is like half a tablet, and then they're maybe on the hypo side, but then as soon as they get off, they're hyper, in your case, more subclinical hyper. But yeah, so, I mean, still, I would, it sounds like, you're, again, TSH around 2 is, you're feeling tired. I'm not sure so much why the T3, 123 is by most lab reference range standards is fine. But again, so TSH maybe, needs to be a little bit, lower than that. And again, just as I've been saying, just, it's, you want to do more than taking the methimazole, which hopefully you and hopefully most people, I know there are some people that are doing a lot more than just, relying on the medication, but, and you mentioned the ketogenic diet, that you're doing that, which is great, but there could be other issues. There could be adrenal issues going on. There could be sometimes hidden infections, gut infections. And, again, just, bringing up, just because I had the interview on breast implant illness, most people attending this probably do not have breast implants, but the purpose of that interview was not only just to talk about breast implant illness, but just to let people, make them more aware of just the effects of toxins in general on our health. So doing things not only from a diet standpoint, which is great that you're doing, keto, but stress management. And again, there might be some other things going on, doing things to reduce your toxic load. And yeah, because again, those antibodies, TPO antibodies, I've seen, some people over 1,000, in the thousands. TSI, I've seen, like 4, 5, 600, but again, once it gets above 300 is when I consider it, to being more of a vigorous immune response. All right. Well, thank you. Hassan also says thank you. And Linda, thanks for doing this. May God bless you. You are welcome. Thank you. And then another blessings to you. Thank you. Elizabeth, thank you. Tanya, thank you again. Thank you. So I will stop the share here. And again, just one more time for those who trickled in late. So the 2 announcements, most of you know, of course, but just the slide was just focusing on the challenge, the hyperthyroid challenge I'm having a week from this Monday, the 5-day hyperthyroid relief symptom relief challenge. But then also the second announcement, which to me is a bigger announcement, is that I'm going to be launching my podcast. Again, plan is almost definitely late August, early September. Everything is pretty much in place. I got the intro and outro music, the cover art. I got some, episodes recorded. The first few are just going to be solo episodes, and then eventually I'll be rotating back and forth between solo episodes and interviews. And then also my plan is to answer people's questions. Anyway. So I'm excited about the podcast, and there'll be more announcements for that to come. So first the challenge, then the podcast. But that's it. So thanks again for tuning in on this Saturday. I really do appreciate it. And Raphael, you are welcome too. And then Henry, is it Henry? Anyway, thank you, everyone. Thank you for your thank yous. And Natasha, thanks. I'm sure I missed some of you, but thank you for your questions. Thank you for, again, taking time. I know here, it was a little bit rainy today, but still, a Saturday is a Saturday. So I appreciate you blocking out time on your Saturday to ask you questions. And hope to see, those with hyperthyroidism, hope to see a lot of you participate in the challenge. Again, that website, thyroidchallenge2021.com. So definitely feel free to register. And again, I'll let you know about the podcast. And I plan on doing another one of these Zoom calls. I think I'm going to do another one next Saturday. So be on the lookout for that. When getting closer to the challenge, my challenges, I tend to do more of these calls just to answer questions and also to make people aware of the upcoming challenge. So, and Deborah, thank you as well. All right. Well, I'm going to, again, call it a day. Thanks again, everyone, for attending. Have an awesome rest of your weekend.